what this is all about. So you're going to see in a moment that what we have here is a plastic model. It's a cheap little plastic model. I've drilled a couple of holes in the molars to represent an implant crown that's screw retained, but the same style, type, and mechanics of using the Implaseal would hold true for a 3-unit bridge, a 4-unit bridge, or a full arch. It doesn't change, right? So as we go, assuming that what we have here is the DentaKOTE S for root sensitivity, and you can see that there's a small seal, so it's a single patient application. Every doctor, I try to tell them, listen, you're not going to see any liquid in the vial. Even though it looks like a lip gloss vial, which it is, that we've re-engineered to fit our purposes, this is basically a single application. It's on the applicator tip, and our product is clear, it's odorless, it's tasteless, and it's got the thick consistency of Vaseline. But all you're going to do is when the patient shows up and says, hey, I've got sensitivity around these bicuspids, you take a gauze, you make sure that there's no plaque, you wipe the tooth, or you use some pumice slurry, and you're taking your applicator and you just go wipe it right on the root sensitive area and get it in between the teeth really well. Okay? And that's it. Now, we can go a step further, and I recommend you do, because some of these people have bone loss and some interdental spacing. So you take a little bonding composite micro brush and you dip it in your brush and just get it soaked. And you take your micro brush and you go in between the teeth and you make sure you cover all the little areas that may be exposed in between. And sometimes you can finish and accomplish it between the real applicator and the micro brush. However, there are times that you can't. And for those times, we use dental tape, preferably. This is just dental floss. And you can take the dental floss and apply some stuff from the applicator on the dental floss. And then this model is not going to allow me to do it, but you can see the idea is you floss where you applied the DentaKOTE on the tape or the floss. You go in between the teeth and you use this in a little rubbing motion in between. Take your gauze, wipe it vigorously, almost as if you're trying to take the stuff off, right? You can actually use another dry micro brush and go in between and wipe it off. Now, is that an absolute necessity? No, but you should, because the optimum thickness of the DentaKOTE is 1 micron, which is about 1/100th the thickness of a hair strand. So the thinner it is, the more effective it's going to be and less stuff is going to get accumulated. And that's it. For the DentaKOTE Classic, which is the black cap, as you can see here, same thing. Single patient applicator. You unscrew it. Once the patient's teeth are clean and before any kind of fluoride paste is applied, preferably not, and just pumice, you go and you apply this thing to all the surfaces of the enamel that are exposed, and you go around the whole arch, buccal, and you do lingual as well. And it's not going to hurt. You can do the occlusal table if you'd like. There's enough product on the tip to do this entire mouth at least twice. Even though it's a single patient applicator, and when you're done, you got to throw it out. You take your gauze and you wipe it all down. This is the complexity of the application. You can see how simple this is, right? Once you're done, that's it. Now let's talk business for a moment, right? We're dentists and we're hygienists. Our goal is to keep patients happy, as I said at the beginning. So what we DentaKOTE are recommending to our patients and our clients is reapply it every couple of recalls. The offices are charging for the DentaKOTE S sensitivity anywhere between $75 to $200 per arch. So it's your call. The cost to the office is $37.99 per tube, right? It comes in a box of 10. So you can do your math how you want to equate it. Same prices for the DentaKOTE Classic. Now for the DentaKOTE Classic, the offices again are charging somewhere in that range, but the benefit is tremendous. When these patients return for their next recall, they're not going to have a tough time with the hygienist. Their teeth aren't going to get sensitive. They're not going to have a lot of bleeding areas, and the hygienist is not going to have painful, hurting hands when they're done, because you don't have to scrape this stuff off anymore. It's going to be that good, and I invite you all to try it. Now let's look at what the Implaseal is, right? Comes in this jar. There's 10 beads inside and they're saturated. Now for the practice here that I'm giving you, I'm going to use a dry bead and I'm going to use this little plastic cotton plier, right? You take your bead and you're going to put it in the hole. Now, you put it in the hole and you can push it down with anything, right? You use an Explorer, whatever it is you want to use. And let me magnify this momentarily. Here we go, so that you can see this better. So you just push it in the hole. You take a gauze, wipe off any residue of that mix that may have bled out, and you take your composite and you cover the hole. That's it. But the same technique is what we would use if you're just doing it on an abutment after you've torqued down the screw. The same technique would hold true if you're doing a full arch. Now, in a full arch, you would take your Classic and you would wipe the entire intaglio tissue side of the case. And let's be real, on a lower arch, there's a lot of calculus accumulation on that lingual aspect, so cover the lingual with this. And on the upper arches, there's a lot of calculus that builds up on the buccal of the molars. So you cover that area, and again, you take your 2x2 and you wipe it. Screw your case down, tighten it, and then you use your Implaseal to close up all the channels. You place whatever composite of your choice on the surface access hole, polish it, and you're done. It's going to change your practice. It's going to keep your patients happy. They're going to come back and say, wow, you know, that bad taste that I haven't had it again. You know, the sensitivity patients are going to come back, recall after recall, and you're going to ask them, hey, how's that area that was sensitive? And I'm telling you, I've got patients now going on 29 months with no sensitivity return. However, in parentheses, we're business people. So what do we want from our patients? We want to keep them satisfied. So every other recall, you reapply it and they pay you again. So it's a tit for tat, right? Now, why are we doing this recommendation? Because I don't want the patient to brush, eat all this chemical liquid and food and have the sensitivity return. I also don't want the patient with the full arch to start having so much debris build up on the linguals. So we reapply it. Now, I'm not telling you every couple of recalls you unscrew the implant case. No. I mean, once this is done, it's done. You may not have to remove that case for 5, 7 to 8 years. And then you reapply it at that point, because on the underside, it's not going to wear away. I mean, this stuff is so strong, it's not going to wear away. I wanted to just give you this quick little introduction to this wonderful product called DentaKOTE and its sister products because they're all interrelated. If you go on our website, DentaKOTE.com, you're going to see that there's another product called Implaseal. And Implaseal is the exact same chemistry that we have in the Implaseal, with the exception that it's in a syringe with a small tip on the end. And that product, all you're going to do is use it to extrude 1 drop on every abutment screw before you place it into the abutment or into the prosthesis. Every screw, whether it's the abutment screw, whether it's the healing abutment, you put it on the thread, or whether it's the prosthetic screws, the little tiny ones, whether you're using the manufacturer's screws or you're using the Rosen screws, you just put a little bit on the thread, torque that guy down. I'm telling you, the bacteria, the fungus, the odors, they're gone. They're a thing of the past. Do yourself a favor. Go to the website, DentaKOTE.com. DentaKOTE's with a K. It's DentaKOTE.com. Here's the name again, DentaKOTE.com. Under the resources tab, you're going to find frequently asked questions. You're going to find the SDS sheets. You're going to find little short videos that I've created to help you understand how to apply these things, not just on bridges, on retainers, aligners, on night guards, etc. This stuff is wonderful. You're going to be happy. And if you're watching us and you're a follower of our Quantum Dental Insights channel, we're happy to send you a sample to try it out. Again, you can visit our website at quantumhh.com. Follow us on YouTube, Quantum Dental Insights, and try this product out. You're going to be very happy. I guarantee it. I'm Dr. Nilo. You can reach me directly at info@quantumhh.com. Either myself or one of my partners will get back to you within the day, I promise. And I look forward to helping you out any way we can. Thank you again for joining us, and I hope you have a wonderful day. Come back and see us soon.